Hi, good morning. So my name is Dr. Mais and Melanie. I'm a GP based at Bingley and one of the clinical specialty leads for children and young people. And I'm joined this morning with...
I'm Melanie Tanner and I'm a health visitor. I've been a health visitor for nearly 15 years. My current role is a clinical lead in health visiting.
Lovely. So we've put the session together to talk a bit about feeding, so your baby's feeding, whether they're breast or bottle feeding. We're going to talk a bit about picky eaters, so how we all struggle with, our young children are fussy eaters. A bit about sleep and how to keep your baby safe at night. And then we'll run a few other things along the way. So if we just start off talking about feeding, Melanie. So breastfeeding and bottle feeding.
Yes. I'm sure you have a lot of enquiries from parents. I'm sure a lot of families will present in the surgery concerned about feeding. It's certainly something we see in baby clinic often, or enquiries on the phone and things, people concerned about feeding. So a very important topic, isn't it, really? And I think it's important for all parents to realise there is a lot of support out there.
Definitely,
Support groups, you've got your professionals such as your health visitor, your GP, the children's centres are feeding advisors, and there's people there who can help or signpost. And I know we're going to share some of the resources after this of where you can go for that help. I think that right at the very beginning as well, it's important to realise that the midwives give a lot of support, and when the health visitor first visits about 10 to 14 days, we do an assessment of feeding, and that can be repeated at any time, and that looks at some of the things that parents might be worried about. So it might look at how well the baby's feeding, and we know, for example, from how many wet nappies, how many dirty nappies, those types of things.
Yes, certainly we get a lot of queries from parents, especially new parents, understandably anxious about how the baby's feeding, and I think the things they tend to be worried about are how long are they feeding for example. What sort of advice would you
Well, I think
give
that's
parents?
Something to there's quite a lot of myths almost about that, because every baby's different and they feed differently, but it's important that people realise it can vary anything from 5 to 40 minutes, which is a huge variation, but that would be potentially normal for that baby, and also getting away from the fact that babies feed at really specific regular times. I think whether a baby's bottle feeding or breastfeeding, the important message is it's about responsive feeding, so responding to your baby's feeding cues and feeding them on demand, as opposed to when you think they need to be fed.
The babies are quite good at knowing when they need a feed.
And
I guess the concern is that it's about noticing there's a change in the pattern of your baby's feeding. So if they're used to feeding for half an hour, if there's a change, trying to sort of identify what could be happening. And alongside that, like you mentioned, it's important to know how often they're having wet nappies, dirty nappies, and being sort of responsive to your baby.
And how they attach, and if they're breastfeeding, is really a big important topic, really. And sometimes the baby might appear that they're feeding well, and it might just need one small change for a bit of advice or support, or it might be one small thing that will make a big difference to how the baby's feeding. Some babies will feed really well no matter how they're fed, but there's other things that are really important.
And we do have breastfeeding advisors in the area that can sort of help observe your feeding, give you tips, and like you said, it could just be one small change that makes such a big difference. We will be signposting some of these resources on the chat afterwards for you to have a look at, and you can just self-refer to these services.
And I was also going to say about when we're feeding, the other really important topic is about when we're talking about responsive feeding, is how you look at your baby and how you respond to them during the feed, and that's whether they're breastfeeding or bottle feeding. We want you to have the baby close to you. If the baby is bottle feeding, try and reduce how many people are feeding that baby, especially in the early weeks. It's really important for brain development and attachment, and if they're being breastfed, for the production of hormones that helps brain development, that contact with the key carers and parents is there.
I think that highlights a really important point, because it's not just the feeding and actually nutrition and for your baby to grow, but that brain development and that bonding is really necessary. Whether you're breast or bottle feeding is really important to sort of to harness at this stage.
Yeah, and making eye contact with your baby and responding to them and learning what some of those cues are from your baby, because babies have different expressions, they're learning so much in those early weeks. It's an amazing time, but babies do need that responsiveness.
Definitely, yes. And I think we were going to touch a bit about sort of safety and hygiene when we're bottle feeding.
Yes, because that's something I think that worries a lot of parents. It's really important that you follow the guidance on the side of the formula, which will say how to make up the feed. Feed should be made fresh where possible. The water needs to be freshly boiled with some new water in the kettle and used within about half an hour, so it's above 70 degrees. See, there are some alternatives if you're out and about, and if need be, to use a flask with the hot water. But it's important to reduce the risks of bacterial infection from the feeds. And getting rid of feed that haven't been used and things like that. So there are some principles, but it's really important that you don't also add extra things to the bottle.
Yes.
Especially if you think the baby's a bit more hungry, don't be tempted. If you've got people saying to you, oh, put a bit of this in, please just stick to the formula and make it up as it says, don't put extra scoops in. And first stage formula is what's recommended for all babies for the first year if they're bottle fed.
I mean, from a GP perspective, we see a lot of mums who are worried about the babies who are vomiting, but otherwise well, and we actually see a lot of overfeeding, like you mentioned, so adding that bit extra. And it's more difficult when they're bottle feeding, because when they're breast they know when to feed and they sort of stop, but when it's bottle they sort of more likely to be overfed sometimes. So if you have a look at the website, at the Facebook page, we are going to send some links on there for breastfeeding, bottle feeding and advice. But we thought we'd move on to sort of how to care for your baby at night.
Yes,
that's a really important.
It's a worry, isn't it?
It is,
a lot of messages out there about how to keep your baby safe. So I think the most important things is we know that the safest place for your baby to sleep is in the room with the parents, certainly for the first 6 months, and in their own cot. It's especially important if the parents have taken any medication or alcohol or drugs or were exceptionally tired, that they don't sleep with their baby because of the risk of overlaying. And I think that's important. When you're breastfeeding at night and you need to have your baby close to you, and we'd suggest then that mums are better laid down feeding the baby, because if they're sitting up they're more likely to fall asleep and slip and injury be caused that way. And sofa sleeping, we'd really strongly ask that people recognise the risks of sleeping on a sofa with your baby, and it's really important therefore the baby is laid safely, and sofa sleeping is not recommended. So sleeping the baby at the bottom of the cot or the Moses basket, they don't need additional bumpers and things like that. It's advised that they're just placed at the base, foot to the base of the cot, on their back, no hats inside. People worry about babies getting cold, but actually if you feel the hands, they may feel cool, but it's the core body temperature. And they don't need a huge amount more layers than we might think they do. So it's really important about, and then identifying any health concerns early and seeking medical advice if you are concerned.
I mean, we know that the advice is that the baby should be put to sleep on their backs. I think a lot of parents come concerned about the shape of baby's head.
Yes.
That's something that we hear a lot about.
Yes.
And what kind of advice have you?
I think the important thing is to talk to families is it's fine to put your baby in other positions when they're awake, and we'd encourage you to. So when they're awake, put them on their tummy, because you're going to be with them. And it could be part of play. If they're laid on the floor, and being flat as well is really important. Being scrunched up in a car seat or something has its risks as well. So babies need to be flat for the musculoskeletal development, and it's really good if they've got toys, put them on different sides. So if you're finding your baby always tends to lay with the head to one side, often any change to the shape of the head will become more prominent because they're tending always to put their head on that side. So put the toys on the other side, approach them from the other side, put them in different positions, or sometimes even just turn the cot or the pram round in wherever it is so that the baby's tending to look more that way. And for most babies, as they grow, the head shape just seems to find its own shape again, doesn't it?
It does, yes.
Yeah.
I think that's a really important point, because if you're in the kitchen or if you're working in the living room or something and baby's in a certain position every day and they turn towards you, they respond to noise. If you just turn the cot the other way, for example, that'll sort of help them move their head around.
But don't be tempted with pillows or anything like that underneath the baby's head, because again, for safety, that is not also recommended.
Lovely. So there's a lot of information we're going to be posting about safe sleeping at night for babies. So do have a look at the links provided. So I thought should we go back to talking about picky eaters, fussy eaters?
Yes.
We hear it. We as GPs get a lot of parents coming in worried about their children being very picky about what they want.
Yes.
What sort of advice, concerns do you tend to hear about?
Well, parents, I think, often have quite high expectations of how much children will eat. So sometimes it's as simple as making smaller portions, giving the child smaller portions. And small things like actually putting a smaller portion on a bigger plate, say an adult-sized plate, will not feel as overwhelming to a child as being given a small plate that appears full of food. So there's little things like that. Sometimes parents seem to go in a desperate effort to either feed the child or wanting to please the child will just give a lot of choices. And I think it's important to remember that children actually don't cope well with a lot of choices. So if you're going to give choice, just give one or two, and that's the choice. And if they don't eat it, don't continually be tempted to go away and cook something else or prepare something else. And I think also we know what an ideal diet should be, but instead of looking at the food pattern over one day, maybe look at it over a week and make sure you're offering things from the different food groups. But you might, for a period of time, have to adjust maybe your expectations of what that is. Some children and toddlers don't eat a huge amount because they're actually being filled up with things that, like snacks. Possibly they're still being given a lot of bottles, even if they're over one, and that fills them up with milk, so then they don't want to eat. So there's a lot of things that maybe you need to look at around what else is happening. And if there's a lot of family members involved in the care of a child, what else are they giving them, the children in between?
And I think it's an important point to make about making some meal times less stressful, regular meal times, because children are very receptive to what other people are doing. So the children, the family, siblings, parents, if they see that they're sitting down for regular meals, it kind of instills that pattern within them because they're very receptive to that at that age. The social side of eating is really important. And it might be that you invite other adults who the child really relates to well to eat with you. I think if you end up with just one adult sat with a child, it can sometimes become even more stressful, can't it? It can,
And maybe to have the conversation not just about you needing to eat that meal, but other topics of interest, I think, and some distraction. It really is important, isn't it, the social side of meal times, and sometimes that gets lost amongst everything else. Really. So
I think a lot of praise for children is always great, but not to use food as a reward for anything, but lots of praise that they're eating their greens or having finished their meals is
I think absolutely positive praise. And if you're not getting anywhere, try to stay calm, try not to get frustrated, take the plate of food away and accept, okay, so that's not worked, but next meal time. And the other thing is that children need to try foods a lot, don't they, before they actually accept that maybe that, especially it's not always just about the taste, it's also around the texture. And if they're not used to those textures and things, so they just need to get used to how other people eat around them. And that's the other thing, is to invite friends for tea. They might have little friends who eat quite well and they can influence each other. And then the other suggestion is think how, so for example, a carrot, you might give it in other forms. You wouldn't be giving raw carrot to a younger child. However, as they get older, think about how else might you offer that food. that makes it more acceptable for the child.
I mean, you mentioned about children who still have a lot of bottles, and I guess that the danger with that we see is that they won't get all the nutrition they need, and they can actually develop things like, you know, an iron deficient anemia, which, you know, it obviously needs sort of treating, and a lot of it tends to be nutritional.
Yes. So I think it's a really good point. So thinking when we're talking about the different food groups, iron-rich foods, so they're going to get iron from things like green vegetables, red meat. If they eat predominantly white meat, try and give them the redder of the white meat, the darker white meat on the chicken. I think it's the thighs and things are quite good. Lentils, dal, and the other pulses, eggs. I'm not sure I said eggs. You know, these are all good things for the iron-rich foods to get them used to. Really, being very aware of sugar content though. And that going back to bottles is, you know, can only urge people not to put anything else in bottles. Juice and things are very harmful to the teeth. Even if they've not got teeth yet, it's going to affect the teeth development. So.
And that's something else we're going to talk about, is teeth.
Yes,
just reminded me. Yes, we'll go back to teeth. Yes.
So
no, I think that's really sort of useful to sort of touch on is picky eating,
and the fact that it is very normal. I think some parents get quite upset because they feel in the first few months, because we would expect parents to, and we encourage parents to start weaning from about 6 months, and in that period from 6 to 12 months, you've probably had an infant who's had a fantastic diet, been offered lots of different foods, and it's been absolutely great, and they get to 13, 14 months, and then they suddenly decide, I'm not eating that. And I think it's important to realise that is normal, it's part of development for many children, but it's also an early opportunity for a child to actually make their own choices, and there's not much else in their little lives they can control, but they can control food. So it's important that's a stage of development, but it doesn't become a controlling factor between you all and the family.
They can be very clever about this, can't they, these little kids? So it's something to...
Yes, so it's about turning it round, being positive, positive praise, and just trying to...
So I think that what's really, I think one of the most useful things and important things you've raised is actually a meal plan over a week, so that you can look at all the different food groups and you can include them in, you know, for your children, rather than having to worry about, you know, individual days and planning what they're having.
And if they don't get a huge variety, well, they don't get a huge variety, but keep trying other things in there.
Yes, certainly. Lovely. So, I mean, you touched on teeth, and that's really important.
It is, isn't it? Yeah.
We're struggling a lot in terms of
the
sort of dental hygiene of children, and sort of what advice we give, trying to be consistent in the messages that we do have about children and sort of their dental health.
And I think the biggest message, be it from yourselves, whichever professional, but dental health especially, is about teeth cleaning. The biggest and best thing you can do is to make sure that the teeth cleaning practices are really good from the beginning. We don't have fluoride in our water here. There are some schemes available, so through the children's centres and dentists and nurseries for fluoride varnish. However, by having good teeth cleaning practices, that can make a huge difference. The health visitors will talk about oral health and dental care. We've already talked about sugar and not putting juice and other things in bottles. And being aware that some of these alternatives to dairy products are quite high in sugar as well. They
are, yes.
And I think that's not always realised. So really important that children's teeth should be cleaned twice a day before they go to bed, and ideally one other time, preferably in the morning, but if not, at another convenient time in the day. And you don't have to buy children's toothpaste. I don't know if people always realise that. It's important that it's has got, if you look on the side, it says how much parts per million of fluoride, and the magic number is 1,000.
1,000, yes.
So you need to have 1,000 parts per million fluoride. And it's just a small smear, pea-sized amount, and that needs to start as soon as the baby's teeth start to come through, to start brushing them. You don't need to worry about rinsing, because if you rinse, you lose the benefits of the fluoride. So and teeth cleaning, those messages are emphasised in nursery and school as well,
Yes.
so they're consistent, as you said. And not to avoid prolonged use of feeding bottles. So introduce a cup. So at 6
Yes.
months, it's fine to start introducing a feeder beaker. But I'd say to mums and dads to avoid the ones that have got a valve in. Now, many parents prefer these because if you tip them up, they don't make such a mess. But the problem is that valve can collect any sugary deposits and
Yes.
can cause as much damage, can't they, as the
They can
actual
do, yeah.
bottle
Yeah.
teats. So it's really important it's a free flow cup. But if you're only giving them water, well, it doesn't matter if it's a bit messy because it's
Sure,
generally
yeah.
just water. And so introducing a cup early and making sure that, as I say, we've talked about sugary foods, teeth cleaning, those are really important, and reducing sweets and sugary snacks. Because even things like the dried fruit and things like that are high in sugar.
Yes, and I think a lot of parents wonder when they should first take their child to the dentist
Yes.
to be seen. And I think that, you know, if they're brushing and it's a technique that they've been shown how to do and they're comfortable, but ideally sort of around the age of 2 that they should be going to see the dentist.
Yes.
And essentially that visit should not be a frightening one.
No.
To try and instill sort of healthy habits and going to the dentist, because we know there's a lot of dental fear
Yes,
and phobia.
there is, isn't there?
So we need to try and make that experience
Positive. I think dentists are quite good at that, but
They are, yes.
I always say to people, from when you go to the dentist for a routine appointment, don't get somebody to babysit. Take your child with
Yes.
you so that they understand this is part of the normal routine. So even if they're too young to have a formal examination, they can sit on your knee, they can
Exactly,
watch it.
yes,
You know, you're going
yes.
back and it's the norm. We recognise that many people struggle to register with a dentist.
Yes.
And I think that's something, there is advice out there and some for how to register with a dentist, but also the children's centres, again, if I can link into the children's centres. You may have seen this leaflet, but there's more information coming about children's centres. They would be able to provide good support as well for linking in with dentists and things. But if you've not got a dentist, like we say, it still doesn't. Still, one of the most important things is toothbrushing and how you care for your children's teeth.
Definitely, yes.
To prevent dental caries.
And like we said earlier, there's lots of resources out there. There's children's centres, nurseries, health visitors that can sort of support for, you know, teaching your child to clean the right way.
Yes.
And getting them to take ownership over that, and for it to be a fun process.
Yes. And the other thing is, many people think they don't realise how long children need supervising for teeth cleaning. So we'd advise that up until the age of between 7 and 8, children need supervising because they'll shortcut.
Yes, definitely.
Or just not appreciate. In 2 minutes
Yes.
cleaning is quite a long time, really.
Yes.
So, yeah.
Lovely. So we've touched on feeding, bottle breastfeeding, sleeping, our picky eaters, how to care for your child at night.
I suppose just going back to caring for your child at night, I think I've probably omitted when I'm thinking about safe sleep and sharing the baby being in bed with you, I was talking about taking medication and being very tired. The other 2 things I should have mentioned is about smoking. If you're smoking, we're saying please don't share bed with your baby because that is a significant risk if you are a smoker. And also if you have a preterm baby or a very small baby, there's another risk factor.
I think the other thing we tend to forget is that if you're smoking, even if you're smoking outside, smoke can be on your clothes and it can be quite significant in terms of sort of, you know, passive smoking, and so it's ideal to sort of change. I mean, ideally not to smoke at all.
And there is advice and support for stopping smoking, and again it's important you get support because we know that people are more likely to give up if they have that support. So there's lots of information in the Children's Red Book which you'll have been given when the baby was born, and that's constantly being updated, so there'll be some more information if you're having a baby in the future. And some of the other resources are on the NHS Choices.
Yes.
And
So we'll be posting all these resources for you to sort of have a look at, which are quite excellent resources to touch on.
And then if there's anything else we haven't covered in these topics, then I think, talk to your health visitor, and we can make sure that people get the information that they need.
Yeah, and if there are particular topics you want us to cover, we'll be doing these. We're doing some more of these live web chats. So please post any queries you have or topics you want us to cover, which we can look at. But thank you for joining us, and I hope you found it quite a useful session. Thank you for joining us, Melanie.
That's fine. Thank you, May.